Have you ever felt a tingling sensation in one leg, like ants crawling under your skin, or been jolted awake in the middle of the night by a sharp leg cramp? Or maybe every evening, your legs feel like they're weighed down with lead, heavy and tired for no clear reason. At first glance, these symptoms might seem like nothing more than signs of aging or prolonged sitting, but in reality, they could be silent indicators of blood clots forming inside your blood vessels, especially in the legs. If left unnoticed and untreated, these clots can cause serious blockages, preventing proper blood flow. This can lead to leg swelling, tissue damage, and in severe cases, life-threatening events. If the clots travel to the heart or lungs, sadly, many people only realize there's a problem when it's already too late, when the pain is no longer a minor annoyance, but a serious complication, like pulmonary embolism or stroke. The most important thing is this: many of these cases are entirely preventable simply by adding the right vitamins to your daily routine. So, which 4 vitamins have been scientifically shown to help dissolve blood clots and improve circulation in the legs? Let's find out. Because these may be the key to helping you stay mobile, light on your feet, and healthy well beyond age 60 without the need for complex medical interventions. At age 60, 70, or even 80, there's one thing we gradually come to realize. Every steady step we take isn't just the work of muscles. It's also a sign of a healthy circulatory system. And if hearing the term blood clot makes you anxious, you're not alone. This is one of the most common health threats for older adults, especially after surgery, long periods of immobility, or in people with chronic conditions like high blood pressure or diabetes. In a recent report by Professor Helen Farnsworth, a geriatric specialist at the Mayo Clinic, she emphasized, preventing and breaking down blood clots isn't a quick fix. It's a lifestyle one that begins with what you put into your body every single day. According to her, certain nutrients, especially 4 key vitamins, have been clinically proven to support healthy blood flow, reduce vascular inflammation, and promote heart and vessel health in older adults. The remarkable part is, these vitamins aren't hard to find. They're right there in everyday foods, easy to incorporate into meals, and safe for most older adults when used properly. In the next few minutes, we'll guide you through 5 warning signs that your circulatory system may be in trouble, followed by 4 top vitamins that can naturally and effectively help dissolve blood clots in the legs and keep your body thriving for years to come. Blood is the river of life. It carries oxygen and nutrients to every cell in the body. But like any river, its flow isn't always smooth. Sometimes, for a variety of reasons, the blood may start to clot in places it shouldn't, such as in the deep veins of the legs. That's when a blood clot forms, and if it goes undetected, it can lead to serious consequences. Normally, clotting is a protective mechanism. It helps the body stop bleeding after an injury. But when the body is inactive for long periods, like after surgery, prolonged illness, or long flights, blood tends to pool in the lower parts of the body, especially in the calves. That stagnation, combined with risk factors like aging, obesity, high blood pressure, or cardiovascular disease, can damage blood vessels. When that happens, platelets and clotting factors stick to the vessel walls and form unwanted clots. What makes these clots particularly dangerous is how silently they form. At first, there might just be a bit of tension in the calf, some swelling, or discomfort when standing for too long. But if left untreated, the clot can grow large enough to block the vessel entirely, or worse, break off and travel to the lungs, causing a pulmonary embolism. In many cases, this can become life-threatening within minutes if emergency care isn't available. That's why understanding how blood clots form and develop is the first step to preventing them, especially in older adults. When natural circulation declines over time, even minor symptoms can be early warning signs. So the question is, how do we recognize those signals before it's too late? That's exactly what we'll explore next. Symptom 1. Shortness of breath and chest pain when taking a deep breath. Have you ever been sitting still or just walked a few steps around the house and suddenly felt out of breath, like you weren't getting enough oxygen? Or maybe you climbed a short flight of stairs and had to stop to catch your breath, with your chest feeling tight or compressed. Many people assume it's just age catching up with them, or that their lungs are getting weaker. But if this happens often, especially with sharp chest pain when inhaling deeply, it could be a serious sign. A blood clot may have traveled to your lungs. This isn't something most people are aware of. A clot may begin silently in the leg, without causing any discomfort. But if it dislodges and moves up to the lungs, it can block oxygen from entering the bloodstream. The body responds with rapid, shallow breathing and stabbing chest pain that worsens with every breath. Some describe it as a knife cutting through the chest. It hurts to lie down, even to breathe deeply. It's often mistaken for a heart attack or pneumonia. But if a blood clot is the cause, it becomes a life-threatening emergency that needs immediate attention. For seniors, whose heart and lungs no longer function as strongly, even small disruptions in circulation can lead to major consequences. So if you've ever had this kind of experience or know someone who has, please don't ignore it. It could be your body's way of sounding the alarm that a clot is blocking blood flow in your lungs. Early detection can make all the difference. Symptom 2, swelling in one leg. Have you ever looked down and noticed that one leg, especially the calf or ankle, looks unusually swollen compared to the other, despite not doing much physical activity that day? That tight, heavy feeling like something is stuffed inside the leg isn't just from standing too long. When you touch the area, the skin might feel warmer, look shinier, or appear slightly red. Some people even describe the skin as stretched so tightly, it feels like it might burst. And even a gentle press can be painful. If that sounds familiar, it could mean blood is pooling in that leg, because a clot is blocking the normal flow upward. When circulation is interrupted, pressure builds up in the lower leg, leading to swelling, heat, and discomfort. This is especially likely after surgery, long periods in bed, or extended travel. Unfortunately, many people dismiss this symptom. They think, it's probably just from walking a lot, or I'm getting older. Swollen legs are normal. But if only one leg is swollen, particularly if it's warm or tender, it's time to take it seriously. Our bodies are wise. They often send signals before things get worse. It's up to us to listen, so we don't face more serious complications later on. Symptom 3, burning or itching sensation deep inside the leg. Have you ever felt like your leg was burning from the inside, even though the skin looked completely normal on the outside? It's not like a surface burn. It's more like a slow fire spreading through the muscles, or a crawling sensation under the skin, hard to describe, but very real. Sometimes it burns, sometimes it itches, but the itch feels like it's deep beneath the surface, impossible to scratch. Many seniors think this is just nerve-related, or that it's from aging or being sedentary. But this may actually be an early sign of inflammation in the deep veins under the skin caused by a developing blood clot. When a vein is damaged or partially blocked, the vessel wall becomes irritated and inflamed. This mild inflammation can spread into surrounding tissues, triggering a persistent burning or tingling sensation, especially noticeable when resting or falling asleep. It doesn't usually come with severe pain or visible swelling, so it's easy to overlook. But it's often one of the first red flags that your blood circulation is compromised. So if your leg suddenly feels off, uncomfortable, or the sensation recurs in the same spot, don't brush it aside. These subtle, odd feelings could be your body's way of alerting you before something more serious happens. Symptom 4, unusual pain in the calf. Has your calf ever started hurting out of nowhere? Even while you were just sitting and relaxing, not exercising or moving around much, it may feel like something is gripping the muscle tightly from the inside. Unlike muscle cramps from exercise or fatigue from walking, this pain is deeper, duller, and tends to last longer. This is one of the most common signs of a blood clot forming in the deep veins of the calf. When blood is stuck and can't circulate normally, pressure builds up inside the vein. That pressure pushes against nearby tissue and irritates nerves, causing discomfort even when you're at rest. The problem is that this kind of pain can be confused with joint stiffness, arthritis, or just being inactive for too long. But here's what to watch for. Does the pain come on gradually, for no clear reason? Does it last for hours, even after elevating your leg or massaging it? Is it isolated to one calf only, If you answered yes, take it seriously. This may be the first and clearest warning sign of a blood clot in the leg. We often overlook lingering pain, thinking it'll go away. But if it keeps returning, sticks to one spot, and doesn't improve with rest, it's your body speaking up. And the smartest thing you can do is to listen. Symptom 5. Skin discoloration: red, purple, or bluish tint. Have you ever looked down and noticed your foot or lower leg had a strange color? Maybe reddish, purplish, or even slightly blue without any bruise or known injury. It might not seem like a big deal, but that change in color could mean blood isn't flowing well to that area. When circulation slows or is blocked by a clot, the oxygen supply to the skin drops, and the tissue color changes. Some older adults also notice that small cuts or scratches on the leg take longer to heal, or that they bruise easily without any clear cause. This isn't just normal aging, it's because the blood isn't delivering enough nutrients and healing cells to those areas. And when healing slows, the risk of infection increases, especially in seniors whose immune systems aren't as strong. Skin discoloration might seem like a small cosmetic issue, but it can be a major internal warning, especially if it's paired with cold feet, persistent leg aches, or swelling on one side. These aren't just everyday aging issues. They're your circulation's way of saying, "Pay attention to me before it's too late." And here's the good news. If you catch these signs early, there's still plenty of time to make changes. Reverse the condition and protect both your legs and your heart. So the next question is, how can we help the body regulate itself naturally? Let's begin with the first vitamin, a familiar name, yet one whose role in circulatory health is often underestimated. Vitamin D3. Vitamin 1. Vitamin D3, the hidden energy source for healthy blood vessels. When we think of vitamin D3, most people immediately associate it with bones, and rightly so. But that's only part of the story. Vitamin D3 also plays a key role in regulating blood pressure, reducing inflammation, and most importantly, preventing blood clots from forming. Your body contains thousands of blood vessels, large and small, and for circulation to function well, those vessels need to be flexible, free of inflammation, and responsive. Vitamin D3 helps maintain that balance by reducing vascular inflammation, one of the root causes of deep vein thrombosis in the legs. What's more, D3 influences the production of a protein called thrombomodulin, which helps regulate blood clotting in the body. Without enough D3 over time, you may be at higher risk of hypertension, sluggish blood flow, and clot formation. One study from Harvard University found that seniors with adequate vitamin D3 levels had a 30% lower risk of developing blood clots compared to those who were deficient. So how do we supplement it correctly? The best source of D3 is sunlight, but you need to expose your skin properly. About 10-15 minutes of morning sun on your arms and legs between 7 to 9 a.m. is often enough. If you live in areas with limited sunlight or don't go outside often, consider foods like salmon, egg yolks, fortified milk, and especially maitake or portobello mushrooms. Supplements can help too. But if you're on blood thinners, always consult your doctor first. Vitamin D3 isn't just for bone health. It acts like a silent gatekeeper for your blood vessels, helping your blood flow properly, at the right pace, exactly when it matters most. Vitamin D. Vitamin C, the quiet protector of blood vessel walls. We often hear that vitamin C boosts immunity, helps fight colds, and improves skin health. But what many people don't realize is that it's also a core nutrient for maintaining strong, flexible blood vessels, especially vital for seniors. Your blood vessels aren't just rigid pipes, they're soft, elastic tubes that must expand and contract thousands of times each day with every heartbeat. For that, the vessel walls need strength and flexibility. Vitamin C helps achieve this by aiding the body in producing collagen, the protein framework that supports blood vessel structure. When your vitamin C levels are adequate, your vessels are less prone to leakage, inflammation, or rupture. Many seniors report that after maintaining a steady intake of vitamin C, they feel less leg fatigue in the evenings and notice faster healing of bruises. You can find plenty of vitamin C in familiar fruits like oranges, lemons, grapefruit, kiwi, strawberries, and papaya. But surprisingly, Guava and acerola cherries, also called Brazilian cherries, contain even more vitamin C than oranges. Vegetables like red bell peppers, broccoli, kale, and spinach are also excellent sources. A key tip: vitamin C is sensitive to heat, light, and air, so it's best consumed fresh or lightly steamed rather than overcooked. Store fruits and vegetables in cool, dark places to preserve their nutrients. For older adults, a daily dose of vitamin C not only strengthens immunity, but also reinforces the vascular system, helping reduce the risk of blood clots and supporting long-term circulation. One small habit that can bring significant health benefits. Vitamin 3, vitamin B6, the silent regulator of blood clotting. When discussing blood-friendly vitamins, most people don't think of vitamin B6, but in reality, it's one of the most important nutrients for managing clot formation and maintaining healthy blood flow. Vitamin B6 works quietly. It regulates homocysteine levels in the blood. Homocysteine is a natural amino acid, but when it builds up too much, often due to a B vitamin deficiency, it sharply increases the risk of blood clots, arterial plaque buildup, and even stroke. B6 helps convert homocysteine into harmless substances. It also works alongside folate B9 and vitamin B12 to prevent blood vessel damage. In this way, B6 not only supports smooth circulation, but also helps fight off silent inflammation in the vessels, an ideal condition for clots to form. B6 is also involved in the production of hemoglobin, the protein in red blood cells that carries oxygen. With good hemoglobin levels, your body, especially your limbs, gets more oxygen, which can reduce numbness, cramping, and that heavy leg feeling seniors often experience at the end of the day. Unfortunately, B6 deficiency is common in older adults due to reduced nutrient absorption, a limited diet, or the side effects of certain medications. The good news is that B6 is easy to find in foods like chicken breast, salmon, tuna, and organ meats. If you're not big on meat, you can get it from bananas, avocados, sunflower seeds, potatoes, and whole grains. B6 won't bring instant results, but with steady intake, it fine-tunes your blood chemistry, like a watchmaker repairing tiny gears, helping your circulatory system work more efficiently, safely, and reliably. Vitamin 4, vitamin E, the shield against vessel aging and clot formation. Some people live simply, take no supplements, and yet enjoy remarkably healthy circulation. Their secret: they regularly eat foods rich in vitamin E, and that's no coincidence. Vitamin E is a powerful antioxidant. It protects your blood vessels from aging and damage caused by free radicals, harmful molecules generated by stress, poor diet, and the natural aging process. When these radicals accumulate, they break down the inner lining of your vessels, causing inflammation, rough surfaces, and increasing the chances of clot formation. Vitamin E acts like a natural shield. It preserves the smoothness of the vessel lining, helps blood flow more easily, reduces clot risk, and enhances the flexibility of blood vessels to respond to each heartbeat. One study from Johns Hopkins University showed that vitamin E significantly improved vascular elasticity in older adults within just a few weeks of consistent use. This is especially helpful for those who often feel heavy, tired legs in the evenings even without much activity. You'll find the best vitamin E in whole, unprocessed foods. Great sources include almonds, sunflower seeds, pumpkin seeds, avocados, extra virgin olive oil, spinach, kale, and broccoli. One important note: if you're on blood thinners like warfarin or aspirin, talk to your doctor before taking high-dose vitamin E supplements, because E also mildly thins the blood. Combining them improperly could increase bleeding risk. However, when taken through natural foods and in moderation, vitamin E becomes a loyal companion, protecting your vessel walls, reducing inflammation, preventing blood clots, and ensuring warm, steady circulation right down to your toes. We've just explored things that may seem small at first glance, but as you've seen, these little signs could actually be the earliest warnings of a silent threat. Blood clots. For older adults, blood clots aren't just a biological event. They are one of the leading causes behind serious complications like stroke, pulmonary embolism, and heart failure. Sadly, many people don't discover the problem until it's too late. But here's the good news. You don't have to wait for that moment. Today, you've been introduced to 4 powerful vitamins D3, C, B6, and E. These aren't exotic, expensive, or hard-to-find supplements. They are natural nutrients that can help your body gently dissolve small blood clots, nourish the walls of your blood vessels, and keep your circulation flowing hour by hour, day by day. Now, I understand that making lifestyle or dietary changes at this age isn't easy. But here's the truth. You don't need to change everything all at once. Just start with small steps and keep doing them each day. You could try drinking a green smoothie in the morning made with kale, apple, kiwi, chia seeds, and a few drops of extra virgin olive oil. It's a tasty way to get vitamins K, C, E, and other antioxidants into your system. Swapping out cookies or candy for a small handful of almonds, pumpkin seeds, or ripe avocado, delicious and rich in vitamin E. Going for a light walk for 20 minutes each day, it could be a few laps around the house, or a stroll to a nearby park. Movement is the body's second heart, helping the real heart push blood through every corner of your body. Most importantly, if you notice any of the symptoms mentioned in this video, write them down. Record the time, how it felt, how long it lasted. This doesn't just help you understand your own body. It can be incredibly helpful for your doctor too. Remember this, healthy circulation isn't just about your heart or veins. It's about preserving your independence, your mobility, your clarity, and even your joy for life. When your blood flows freely, you feel lighter on your feet, your legs ache less, your sleep improves, and your spirit lifts. Yes, aging can slow things down, but slowing down doesn't mean stopping. Every gentle step you take today, every small change in your eating habits, every time you choose to care for yourself with knowledge, that's how you strengthen your legs and protect your heart. Whether you're 60, 70, or even 90, your health is still something you can nurture, starting with the simplest of actions. If you found this video helpful, please click like, subscribe to the channel, and share it with your loved ones, especially those entering their senior years. Because who knows, a simple share from you today could save a pair of legs, a heart, or even a life tomorrow.